The government, under fire for its failure to deliver basic health services in public hospitals, is now turning its attention to the private healthcare sector, proposing sweeping reforms that critics say amount to a veiled crackdown. Welcome back to our news channel. Don't forget to like, subscribe, and turn on the notification bell. Through the Medical Services Amendment Bill, government seeks to regulate how much private hospitals can charge and compel them to admit and stabilize patients in life-threatening conditions for at least 48 hours, even if those patients cannot pay upfront. Justice Minister Zihambi tabled the controversial proposals in Parliament this week, describing them as a necessary alignment for healthcare delivery within Section 76 of the Constitution, which guarantees every citizen the right to basic and emergency medical health care. The bill will give the Minister of Health sweeping powers to cap fees and limit increase at private hospitals, effectively placing them under state control. An attempt to exceed these limits or raise charges beyond government section thresholds would require written approval from the minister. In quotes, this bill, Mr. Speaker said, is a statement to our commitment to ensuring that every citizen and permanent resident has access to essential health services, said Zihambi. But critics argue that the move is less about protecting patients and more about shifting the burden of a collapsing public healthcare system onto private players. Zimbabwe state hospitals have been decimated by decades, underfunding, corruption, drug shortages, and flight of skilled professionals. Most facilities lack even the most basic medical supplies. Now, rather than fixing that broken system, government is effectively forcing the private sector to carry the weight without addressing the root causes of its crisis. Another key provision would compel private institutions to provide emergency care to patients in life-threatening situations, regardless of their ability to pay. These patients must be stabilized for no less than 48 hours before they can be discharged or referred. The government, through the Health Ministry, may enter into cost recovery agreements with private institutions for such services, though no clear mechanisms have been outlined for how or when this compensation will be provided. This is the end of our news headline. Don't forget to tell us what you think about it in the comment section, and please turn on the notification bell for more updates.